Imagine that you are a nurse caring for an 82-year-old woman named Frances. Frances has been in the hospital for a few weeks after sustaining burns on her legs during a cooking accident in her small apartment, where she lives alone with her dog, Cap. Upon admission, Frances reported that she has no surviving family, and her support system seems to only consist of other elders who live in her neighborhood. Due to transportation difficulties, most of her neighbors are unable to visit regularly. One of Frances's neighbors, who has reported that she has been caring for her, has been watching Frances's dog while she's been in the hospital. Frances begs you to let her friend bring the dog in for a visit. As she asks about this, she begins to cry and tells you that she and Cap have never been separated. You recall that the staff discussed their concern about Frances's well-being during a report that morning. It was also mentioned that she has been eating very little and seems to be depressed. Today, we will explore Nightingale's theory of person and environment and identify specific interventions that we could provide in caring for Frances, and particular actions we would take regarding her request to see her dog, Cap.
Florence Nightingale's theory of person and environment was developed through her personal, societal, and professional values and beliefs. It is a practice-based theory that focuses on the idea that a patient's environment plays a significant role in their health and healing. The 5 essential components of Nightingale's ideal environment are pure air, light, cleanliness, efficient drainage, and pure water. Pure air is provided through appropriate ventilation and includes the temperature of the room, which should not be too cold. This is achieved by opening windows to let in fresh air or heating a room enough to make the patient comfortable. Nightingale believed that direct sunlight is necessary and that patients should be positioned so that they are facing natural light. Efficient drainage is accomplished by using appropriate methods to dispose of bodily fluids and waste in order to avoid contaminating the environment. Finally, pure water is important for bathing patients as well as frequent hand washing. Other aspects that make for a healthy environment, according to Nightingale, include quietness, a suitable diet, including the timing and quality of food, and petty management, which is where the nurse has control over the physical and administrative environment and is carried out by protecting patients from bad news, keeping out negative visitors, and helping to avoid any sleep disruptions. Nightingale was also firm in her belief that pets, specifically small animals, could be comforting to patients and help them feel better during stressful periods of care. At the time when Nightingale was developing her theory, she believed that disease was a reaction to the conditional environment and that patients went through a reparative process in order to heal. The role of nursing was to prevent any disruption in the reparative process and provide optimal conditions to enhance patient healing. She believed that people desire good health and will cooperate to allow this reparative process to occur so that they can get better. She suggested that patients be assisted in retaining their vital powers by meeting their needs and putting the patient in the best condition for nature to act upon. Nightingale insisted on clear decision-making and believed that indecision or the changing of decisions could be harmful to the patient. She also believed that it is necessary to observe everything about a patient and their environment, and that nursing should be practiced with common sense, perseverance, and ingenuity.
Nightingale's theory regarding the benefits of pets has been substantiated by a number of studies through the research of AAT, animal-assisted therapy, particularly in older adults. Since older adults begin to develop physical, psychosocial, and cognitive changes, they may have trouble adjusting to the new lifestyle, which can cause depression and anxiety. A group of nurses conducted a systematic review of studies that implemented AAT into their patient care to analyze its health effects. The results revealed great improvements in the patient's behavioral, psychosocial, physiological, and cognitive domains. Patients' social skills improved through discussing the animals amongst each other. Being able to walk, brush, feed, and play with the animal increased self-esteem and independence. This also increased physical activity, improving their muscle strength and balance, and the relaxation prompted by the animal decreased cardiovascular stress responses. The patient's cognitive domain improved through remembering the animals' names, how to care for them, and the games they enjoy. Another study was conducted using dogs to treat symptoms of depression and anxiety in institutionalized elderly, and found that dog-assisted therapy helped to decrease depression. Low food intake has also been associated with depression and anxiety. Frances may be having feelings of depression and anxiety due to separation from her dog, Cap, which in turn may be causing inadequate food intake. Malnutrition and inadequate food intake have been associated with prolonged length of stay, comorbidity, mortality, and increased hospital costs. Providing Frances with snacks and alternate meal options, having someone to assist her during mealtime, and preventing interruptions should improve Frances's food intake, help with her depression, and speed up her recovery.
The College of Nurses of Ontario provides professional standard guidelines that all nurses must follow. Applying this to the case scenario, we see how many of the guidelines influence the care that is being provided. Starting with the first one, which is accountability, in the case scenario, the nurse would demonstrate this by ensuring that she's providing the best possible care for the patient Frances, as well as advocating for her on her behalf to help her see her dog. The nurse would also demonstrate continuing competence, knowledge, and knowledge application by taking the time to do research and providing evidence-based rationale when making decisions. Part of her following ethical guidelines is ensuring that she's not making the patient feel bad when the patient gets upset and expresses how she can't see her dog. She would abide to the leadership guideline by choosing to advocate for the patient, which role models professional values and attributes. And finally, by the nurse taking the time to listen to the patient, understanding her, and helping her, she's establishing a nurse-client relationship, which demonstrates the relationship guidelines of the CNO.
In terms of interventions that we would provide while caring for Frances, based on Nightingale's main theoretical concept of having healthy surroundings for healing, can be implemented in her hospital room by providing a calm and quiet environment. This can be done by opening a window or curtain to provide light and fresh air in hopes of making Frances feel better and less depressed. As nurses, we need to support Frances and let her feelings be heard, especially since she doesn't seem to have a strong support system or many visitors coming to see her. We as nurses need to advocate for our patients and provide them with the best care as we possibly can provide. In terms of variety, having Cap the dog there for a visit will provide variety for Frances. Nightingale's theory suggests that this can help in recovery by stimulating the patient and changing things up. Being able to see her dog will be very exciting for Frances and probably help her feel less depressed. Nightingale also believed that manipulation of the environment could help in preventing disease and enhancing patient recovery, and having the opportunity to visit with her dog would definitely be a manipulation of her environment. As nurses, we would make sure to clean Frances' burns and redress her bandages before meeting Cap to avoid any potential risk of infections. Frances isn't eating very much. According to Nightingale's theory, providing small amounts of food more often may be more enticing to a healing patient. So we as nurses could try this with Frances, although it is likely that her appetite is low due to her depression, which may only be improved with a visit from her dog. Nightingale believed that nurses should always be observing patients and their environment. Since Frances lives alone in a small apartment, we could assess and question her and her friend, find out how exactly she burned herself, and try to help her in preventing anything like that from happening again in the future.
Nightingale believed that nurses should be great observers as well as advocates for the patient's needs. Therefore, in terms of action, we would listen to Frances' request to see her dog Cap. We would do this by voicing her wishes during the next meeting. It would be important to bring this up with the other nurses who have also been caring for Frances and find out why they haven't been listening to Frances' needs. Nightingale recognizes that a small pet would be a great companion for the sick, and we have learned about the scientific evidence to support this theory of a pet helping patients feel better during their recovery. Seeing a familiar face such as her dog would likely enhance her mood, potentially bringing her appetite back and increase her engagement in the care plan and healing process. Nightingale insisted that nurses must protect the patient from any distress, so Frances' wishes should be recognized. If the hospital approves Frances to meet her dog, the nurses can facilitate a meeting between Frances and her friend who is looking after Cap. It would also be important to make sure that her burns are well protected during the dog's visit to prevent any infections. However, if the request is denied, maybe because of allergies or fear of the dog not behaving well, an outdoor visit may be an option if Frances was well enough to leave her room to go outside. According to Nightingale, variety is an important aspect in the patient's healing experience. Bringing Frances outside would provide variety in her environment. In addition, she will have the opportunity to get some fresh air and sunlight, which are also important components in Nightingale's theory. It is also vital to determine if her burns are immune compromised, meaning of possible risk for infections. Then we would facilitate a video call with Frances and her friend so that she could at least see her dog virtually. We could also bring transport to Frances' friend who are her support system. According to Nightingale, the nurse is in control of who visits the patient. Since the patient needs interaction, the nurse can find a way for her friends to visit, which would likely make Frances less depressed. With all these options, it is important for us as nursing staff to come up with a clear plan of action before approaching Frances. Nightingale insisted on clear decision-making. Unclear and changing decisions could be more harmful for the patient. A final decision about the dog must be made and approved before being presented to Frances.
After presenting our case based on Nightingale's theory at the next morning's meeting, our request for Frances to see her dog was approved, and Cap was able to come for a visit. This lifted Frances's spirits so much. She wasn't sad anymore, and she even ate a full meal for dinner while telling the others on her floor all about her visit that happened, thanks to her nurse's application of Nightingale's theory of person and environment.